Hi, Asmitha. So lovely to meet you.
Hello,
And
doctor.
when I speak to you, I was very clear that I'm going to wear the sari you people gifted me, and I love it. And
It looks beautiful.
thank you so much, Asmita. It really, gifts from my patients, I really treasure them and I feel so happy in the entire day when I wear them. Last week also, I wore some sari which was given by my another fertility patient. So this week, I'm so happy to meet you like this. And I just wanted to you to share some experiences of yours associating with us, your fertility journey, and also about your 10-month-old now.
Yeah, yes. Sure, sure, doctor. First of all, you really look beautiful.
Thank
And I'm so
you.
happy that you're wearing it. As soon as I see you, I always see you in some beautiful sari, well dressed. I always admire that.
Ah, wow, nice.
Uh,
Okay.
Thank you for wearing this. You already know my story, but yeah, I'll just say so. Uh, I would say since I got my first menses, since then I never had a complete cycle or proper cycle in place. It was always very painful, really painful. I
Mm,
was in school and I remember struggling every month with the extreme pain, and it was always 6 days, 7 days. That was the period which I get. So it was always very painful. I struggled through my school days and my college days, then
mm,
my working space as well. So in workplace also it gets affected because every month if you can't just go and tell I have pain. And
right.
mostly we work with a very environment where there are mostly men.
Mm,
Most of the time you have men as bosses. So it's
right.
hardly two times in my whole career I have got women as my boss.
Mm,
So it's little not very at least I think today's generation is much more open, but at least in
correct.
my time, almost 10, 15 years back, we were little conservative at that time. So not something we want to go and tell every month. So I have worked with, taking pills, painkiller, just to calm myself down. You don't want to take leave every month, but sometimes it's really painful. I had such a painful journey, doctor, that, I remember crying and,
Mm,
not able to sleep and very heavy bleeding. So it was really always very painful. And I actually went to almost all the gyno I can say in Bangalore at least. And I would not only say Bangalore. This has started, when I was child. So I have
mm,
been
mm,
to all over country and I have been to most of the gyno. So and it was always the same kind of stuff which I heard many times. Yeah, they will tell, oh, your weight is too much,
mm,
or
mm,
you're
mm,
not having you're you must be having junk food, or you are doing always some blame on
correct.
me only, or
Mm,
your genetics or anything. So you feel, when you hear this for 10 years or 12 years continuously, you feel like something is wrong with me. I am not doing something right. Everyone else, and like I said, nobody shared this.
correct.
So
Mm,
even our among our best friend women tends to hold all their pain within them and struggle through it alone, or maybe close to their mother or sisters or anything, but not among friends also. We don't share such details, so you feel like you are alone struggling with it, and you're then getting this blame as well, that it is because of some fault you are doing. So I have gained weight, I have lost weight. I did everything, I think, and I'm a vegetarian as well, so I don't tend to eat so much,
mm,
anything which can cause my body harm. But still, I always felt, yeah, something is wrong with me. I was on pills for almost 2 years, 3 years, and that
mm,
that actually messed my system. All my college life, I had when I tend to went off through from the pills, I started getting really very heavy bleeding. This continued for very long, and then around 8 years back, uh, actually I started getting bleeding, and it didn't stop for 4 months,
mm,
and it was continued, and I was working as well. Uh, and I never shared this with anyone. Only my family knew about this, uh, and that's when actually at that time I went to all the gyno, and they were saying, at that time I was married. So as soon as I went there, they were telling me, you are married, why don't you have a child? If you have a child, this all problem will go away.
Hmm.
or you are starting gaining weight. It's all because of this. So we were very young when I married, and I think child is a responsibility everyone should take very seriously. So you have to have child when you really want to have child, or you can
Absolutely.
take that responsibility. So at that time, we thought that we were too young to have. So we never wanted at that time. And but every visit you go to doctor, and the only blame you get is this, that you're not having child, that's why you have this issue.
Hmm.
So it was very depressing. Again, because my bleeding was not stopping, I had to go to gyno. They still gave me medicine, and it actually made it worse. And it came to a point that I have lost so much blood that my body was almost not able to. I was feeling very weak. I tend to get sometimes faint feelings. So I told them that no, it is making my thing worse. But the thing is, I was at that pain, and they still told me, no, no, it couldn't be because of this. You are doing something. It is not because of this. So I felt really bad. Then I changed again a doctor, and I went to another one. So she said, okay, let's first stop your bleeding because it's already 4 months. So we'll do a DNC. So I went through DNC operation, and this is all while I was working every day. They nobody office they did realize something is wrong, but again, like I work with mostly male
Right.
colleagues, and you don't tend to share this. So I went through the operation, but unfortunately that went wrong, and my lungs got infected because of the anesthesia they gave. Uh,
Hmm.
I was in ICU for 2 days, and that's when you hit rock bottom. You really feel okay, something is really wrong with me. And if you ask me at that time, I don't even think about child because
Hmm. Hmm.
I was thinking, if my normal things which every woman gets in the world is not stable, how
Hmm.
can I have a child? So it didn't even strike me, not even my husband's mind. He was very supportive, and he said, yeah, let's have you healthy, and then that's enough for us.
Hmm.
So then we came out of ICU, and I didn't know what to do because unfortunately it did stop for 3-4 days, but it again started.
Okay.
So you are not supposed to have, you had just had DNC. What else can I do? So
Hmm.
that's when maybe my husband would have shared with his office people, because he was also taking leaves. That's when his one of his colleague, who was your long time visitor and patient. I wouldn't say patient. There's someone who used to come to you, and he and his wife. So he suggested my husband that, why don't you try something else, and maybe there is Dr. Anupama and Dr. Santosh,
Can you
and
increase the
can you?
volume a little bit, Asmitha? It is going down.
Okay, okay, 1 second. Let me just. Can you hear me now, doctor?
Uh, I can hear you. It is just that it feels a
Okay,
little soft.
okay. Yeah, now
Now
can you
it is
hear,
better.
doctor?
Now it is better. Yeah.
Okay, okay. Yeah, I tend to go slow sometimes. Yeah. So okay, please tell me if yeah, it's not
No,
audible.
no, it's fine. It's fine.
Uh,
Go on.
Okay, okay. So that's when he actually suggested my husband. If you notice, it's my husband's friend who suggested
Correct.
it, a male, another male. So I
Hmm.
didn't come to know through my own circle, and that was something. We are still very, blessed that he told us something different. And that's when I came to you. I was still bleeding when I came to you,
Hmm.
and it was almost 5-6 months done. And that the best thing when I first came to you, the way you made me feel comfortable. First time in my life, doctor, nobody blamed me. As when I spoke with you, you told me, oh, this happens with lot many women, and we will solve this step by step. And you never judged me. You never said, oh, are you married, go have child. You never told, oh, you are maybe looking overweight, just go and lose your weight, or you are eating something wrong, or you didn't judge me at all. You first heard my story. And this I still tell to my husband, that I go to Dr. Anupama not only for my this health. I also, it is also like when I speak with her, I get a calm, someone to share my things. That's still there, doctor. I'm always grateful for that. So you actually guide to listen to my story really well. You gave me a whole hour, I think more than that, and then you told me, okay, we'll take it step by step. So first thing you told me was, let's cool down your body, because maybe my body was very heated and that's why we're still bleeding. So it was not, you don't give me bunch of medicines, just go take it and it will stop. No, you ask me, let's cool down our body in very natural way, that okay, we will cut off such these kinds of vegetables, let's eat these vegetables which calms your body, like all the gods and these things. You didn't ask me to fast or anything, no, nothing. You just asked me to eat vegetables which will cool your body. I still remember this. So I started doing that, and I think some medicines as well. I think, but it was not much. The first few treatments, and within 5 or 6 days, my bleeding stopped after 4 months, and that's when I got a little confidence. Okay, yeah, this can work. And then since then, I have always been with you. So we started with the whole diet thing, how we are supposed to eat and what we can avoid, what we can eat, all that. And you also gave me some few medications in the beginning, Ayurveda medications. And so that actually started making my cycle regular.
Wow.
And I'm telling you, this happened first time I had, since I think I had my first in menses in 14 something, and
Mm.
since then, almost how many years later, this first time my cycle was proper, and then we continued with the process, same thing. Okay. Not only you helped me with the this my reproductive system issues, you also kind of calm my anxiety. So I was a very anxious person, and I tend to take overload of work and work pressure. So you always calm my anxiety, and you help me with many other things as well. How to control yourself, and like, so those are very really helpful time for me. And best thing, like I said, you never forced me. Let Asmita go into try a child. To be honest, at that point of time, me and my husband, we never thought about it. And you always said, Asmita, I support you. Whenever you want to have, then you can have. And to be honest, many times I told you I don't think I can have, seeing my history. So you said, oh, I have never seen someone so not don't have any faith on yourself itself. So you were more confident than us. We were not that much confident. So but then many years, I think after 6 years with you or 7 years with you, that's when we thought, okay, let's see if we can try and all. So again, we didn't went on any medicine to try. Okay, to
Right.
be honest, we just told you, yeah, maybe we want to see if we can do. So we did, you actually asked me to do all your blood checks and all. To how does it? So that's another good thing. You are not just giving advice, simply. Okay, then most of the tends to I know the doctor tends to say this. Okay, they don't take
Mm.
the current medicine advice and test, and they just simply advise you that, no, you don't do that. You actually asked me to do all the blood work and all the scans and everything, and we did that. And then you looked into it, and then you started, okay, now it looks fine, so we should start doing the checking what can be done. So fortunately, I had one miscarriage, but after that, yeah, that miscarriage also, yeah, I was very depressed. And then, but the next time, and it happened so naturally that I didn't even realize. So first time when I realized you were the name, I first came to me, and I think you were the first one I messaged. Doctor, I can see. What does it mean? Because I have never seen, I was still very shocked that is it dark enough, 2 lines to show that I'm still pregnant or not? And you don't know, it looks very dark. Go do the test, and that's when I went and get the test done, and was a good news for it. We also did, if you remember, before starting this whole process, you asked me, let's do a panch karma. So I think I also did a panch karma
Yes.
few months before this, and it was like a detoxification. I it not only it helped me in fertility, it also calmed my nerves down. It helped me reduce some weight, and my cycles, my digestive system, everything actually went on a very good cycle. So before I got conceived, I was at a very good physical and mental state. I would say that really helped, and I reached there in a good amount of time with the slow process, and uh, repetitive processes, and still believing on yourself. But I think Panchkarma was the last thing that gave a boost. With
Correct.
that, my cycle and everything got, so it was not only my monthly cycle, but my digestive system, everything was very stable. And that's why I say my husband, that's why we have got a very happy child. So,
He is. Absolutely.
so yeah, after that treatment, I just naturally got pregnant. And there was
Mm.
nothing special done at that point of time. But I think we have done the work previously as well. And not only after got pregnant, it's not like it was the end. No, after that also we were in contact, and you gave me, the full chart of what food I should eat, and few I don't know the names, but some of the treatments and some tonics which I should use still to maintain a good health.
Yeah.
So we continued with that, and I think overall it went really well. I think I also took something in between. I don't remember the name of
Yes, yes. Yeah, the
the
Mumbai
yeah,
lemons. Yes, yes.
yeah, yes.
Yeah.
Oh, and that helped as well. If you remember, I had a case where my amniotic fluid actually was
Correct.
going down in the last month. So even my gyno, she told me, we may have to do the delivery early because, this is the case. If it goes very down, do whatever you can do. That's what she said to me. Drink water, and they gave me some medicine. But she also told, luckily she was, honest enough to tell me that this will not do anything. We are just
Mm.
giving you,
Mm.
and I showed you as well, doctor, this is happening. I may have to go into early. So that's when you gave me that home
Mumbai
delivery.
medicine. Yeah, it
Yeah,
improved
home
your
delivery.
AFI
Yeah.
and
Yes.
you didn't have
Yes.
to go in for the delivery
Yeah.
sooner. I
No,
remember
no.
that.
It actually increased. And
Increased
when I
it.
went for
Uh,
scan next time, doctor, she asked me, what did you do? What did you do then? It got, increased. It has not decreased. So she said, whatever you did, just keep doing it. And we will stretch. So I did complete my whole 38 weeks
Term,
also.
yeah, full
Not
term.
before.
Yeah.
Yeah, I did full term. And then yeah, then I went into the delivery, and a
Yeah.
very healthy baby.
How old were you, Asmitha, when you conceived?
I was at 36 years.
You're 36. Now, I
Yeah.
want
And
women
that,
out there who are listening to
yeah, to
understand
know.
that it's
Yeah.
possible.
Yeah, 100%. And if you see, like I said, I never believed, so we never also tried. So we were not the one who went into depression, or like, oh, we were like, we first want our health, and then we
Mm.
feel strong enough, we try to have. That's when I told you, doctors, and I said, I think I'm too old now. So you say no, no. And since I forgot to tell, I had PCOD, so because of that, all this
Correct.
problem I faced.
Yeah, yeah.
And sometimes they used to diagnose, sometimes they used to just ignore it. And but when I came to you, and since we did all the blood works, we got to know, okay, I have a PCOD, and let's solve that problem. And I think that is the thing
Yeah,
which
that was your
triggered the whole
fertility treatment. Even your
yeah, that was my
panchakarma,
treatment.
yes, yes.
Yeah.
Even your panchakarma was for your PCOS and your anxiety. That is how I planned it for
Yes.
you, and it
Yes.
helped because of that,
Yes.
right?
Yes, 100%. I think that is the thing which actually helped. So we
Yeah,
we were able to solve that issue, and I think yeah. So even at that age, you told me, no, Asmita, most of the patients who are from PCS, they tend to get have a better reproductive system
correct.
in late 30s as well. So you
Yes,
don't.
yes.
That is again like a motivating thing to say. Well, if I go to other one, they would have told me you are too late. Now go. I was actually advised to do IVF,
IVF.
and to
Okay.
be honest, I was very scared. I tend to read everything, so I read what is the thing, and I said, okay, maybe we are not. We are happy. We'll adopt. I have to be honest.
No.
But you gave me the strength, and I got pregnant at 36, and now I'm 37. Yeah, I think I'm the best health at present. And
Excellent.
even after the whole delivery, if you see, I recovered faster. And from the third day of my delivery, I had so much strength. Even everyone in my house used to tell, how is she moving with so much, force. So
Mhm.
I think it has long effect. I'm still feel, good
Yeah.
enough. So,
Yeah.
thank you
No.
for that. And I'll not leave you. Like I said, it was not only fertility treatment, it was a life cycle, lifestyle change for me. You are someone I want to stay connected whole my life. I'm still taking your advice for my doctor, the medicine, the small, I don't know the name, doctor you gave me for to give him from very early days for
For
the
the
children.
immunity of your
Yeah,
baby.
yes, yes.
Yes.
And
Yeah.
I'm telling you, it helped. He has look at the weather, the things are
I
changing,
know.
and he's the one he has not got.
No,
I mean,
touch wood,
he
touch
doesn't get
wood.
any cold. Yeah, touch wood. So I think it's working. So
Yes.
I'm.
Yes.
I may advise my friends' kids also if they want to, because people tend to get scared to start with unfortunately,
Unfortunately,
and
yes. Yeah.
yeah,
Yeah.
but
There's a
I
lot of
advise them.
misinformation out there. That's why I'm
Uh,
making this effort,
yeah,
to reach out to people, to make them understand
yeah,
it's a very scientific way of doing it,
yeah,
looking after your
yeah,
health, not chasing fertility treatments until,
yeah, yeah,
you
yeah.
are in a good place, good health.
Yes,
And I
yes,
see patients, PCOS patients doing IVF without no treatment for PCOS at all. They're told that the PCOS is very mild or
yeah,
you don't need PCOS
yeah,
treatment and all that.
yeah,
It's
yeah.
very hard. Uh,
Yeah, and then they tends to fail, and that it sends them in the same
A
cycle
vicious
of,
cycle, yes.
yeah,
Yeah,
yeah, it's
yeah.
the and your body is hurt so much. So in any treatment people take, I think first they have to take care of their health and do try naturally, like you
Yeah,
helped me.
yeah,
That
yeah.
way we should try. And like you said, there's not good information out there. That's why I was lucky
Correct.
enough to got connected to you. But yeah, but it's I think this should really help if anyone
And
else
I'm very
listening.
glad you came ahead and, spoke about it. It's not very easy to talk about it. And, you're doing it for other women who are listening to this to make them understand that this is possible. And I mean, what a journey. And
Yeah.
really, hats off to you. And really, thank you, Asmita. Thank you so much.
Uh, Thank you, doctor. I'm always thankful to you.